Thank you all for joining us for our third and final session of our chronic kidney disease and nutrition series. My name is Lily, and I am the Office and Billing Manager here at Community Health Resource Center. Today's presentation will focus on meal planning and sustainable approaches for managing CKD. I'd like to thank our partner, the National Kidney Foundation, and our sponsor, Horizon Therapeutics, for helping make this series possible. Today, we will continue with a presentation from the director of our nutrition team, Elena Zidaru. In addition to Elena's presentation, we also have nephrologist Dr. John Mouratoff joining us for a panel discussion moderated by Franco Reyna with the National Kidney Foundation. Franco, I'll let you introduce yourself and give us some more information about Dr. Mouratoff.
Thank you. Welcome, everybody. Welcome for the third of our three session series. Today, I think we'll try to put it all together for you and then have quite a bit of time to answer any questions that you might have personally. But we have a wonderful guest coming up. We're waiting for him to join us at the second part of the conversation for today. Dr. John Mouratoff, who is actually a practicing physician in the Oakland, California area, the Bay Area, close to the area where we all service local communities. So anyways, thank you very much again for joining us. And I want to thank once more our sponsors, our collaborators, collaboration here with the Resource Center, and thanking you all as well for making the time to be with us each and every week of the last 3 weeks that we've been together. So thank you very much. And I'll pass it back to Lily or Elena to proceed with our today's conversation.
Thank you, Franco. Yeah, I'm going to go ahead and let Elena get into the presentation.
Yeah, well, welcome back, everyone. I can believe it's already the week 3, so time definitely flies by. But also, this is, in my opinion, the most exciting kind of presentation because we talk more about planning and meal suggestions and kind of putting all that information from week 1 and 2 into more practice. And I feel people like the more practical things. Today's presentation definitely focus on meal planning. And the class outline includes we're going to review a little bit the recommended diet patterns for CKD. And then we're going to go in more detail about how to read the nutrition label, what to pay attention to, portion sizes, definitely some tips on meal planning, and some examples of some meals that could be on the plant-based diet pattern that we talked about. Some tips on behavior change. We all know the change, sometimes it's hard to make. A lot of times when I meet with clients, patients, they tell me, I know what to do, right? I know what to do, but sometimes it's just hard to implement and make those changes, right? So there's definitely a difference between what you know versus what you do, or what you can do, and how you support yourself through the change. So we're going to talk about that. But as a review, the recommended diet patterns for CKD, we talked about plant-based diet last week, how there's definitely an increase of evidence that plant-based diet can be very healthy for CKD and really slow the progression or stop the progression of CKD. Now, the ones that are here listed, DASH diet, Mediterranean diet, diabetes-friendly diet, which is a more carbohydrate-controlled diet, they can all actually be part of this plant-based diet. So plant-based diet can be an umbrella of all those things. And if you remember, I showed you that picture of my plate, and you'll see it again. And I'll describe a little bit more how those diets can be actually similar, even though they have different names, and there's some small differences between them. In that, the main kind of thing that they have in common is that they're all plant-based diets. So the DASH diet, which as you remember from from last sessions, I said it stands for dietary approaches to stop hypertension. So it's a diet that was promoted as a way for people to manage better the blood pressure. Has been recommended by National Kidney Foundation. And this is also because it helps managing blood pressure that can be a risk factor for CKD. And again, because it's a plant-based diet and falls into that category, can be, again, helpful to slow down the progression of CKD. So usually it's a lower sodium diet. It's a diet high in fruits and vegetables and whole grains, and includes more lean proteins. So those are the main features of the DASH diet. The DASH diet that's recommended by National Kidney Foundation for stages 1 or 2 as a way to, as I said, stop the progression of CKD. It can include 7 to 8 daily servings of grains, 4, 5, or even more servings of vegetables, fruits again, 4 to 5 daily servings, low-fat, fat-free dairy products, 2 to 3 servings daily, lean protein like lean meat, poultry, and fish, 2 or less daily servings, so not a high kind of animal product type of diet. The way I said, it's more plant-based if you look what people should eat more often in a day. Nuts and seeds and dry beans, legumes, 4 to 5 servings per week. That would be basically a serving, almost a serving every day. And fats and oils, 2 to 3 daily servings, and sweets to limit to less than 5 servings a week. So that means maybe not having as often sweets and treats. So this is the DASH diet. Then the Mediterranean diet, when you look at this pyramid, and again at the base of the pyramid, what I'm circling here, they're plant-based foods. You could see here fruits and vegetables and grains of all kinds, nuts and seeds, some legumes, and then we have the olive oil and the avocados as healthy fats, part of the Mediterranean diet that was designed more for heart healthy. At the base of this is like also physical activity and sharing meals and eating with family and friends. We have here then more fish and shellfish 2 to 3 times a week, poultry, eggs, cheese, and yogurt, moderate portions daily to weekly. So, and then red meat at the top to not have as much. But again, when you look, the bulk of the foods, the majority of the foods that are encouraged to eat daily would be plant-based foods. So another plant-based type of diet. And then diabetes, my plate recommendations. So this is something that I recommend for my diabetic patients. This is something I recommend for people that would like to lose weight in a healthy, sustainable way. This is also what I recommend for my cancer patients, that are recovering from treatment and they're trying to eat a healthy, balanced diet to decrease the risk of cancer reoccurrence. And the reason why it's a diet good for all of those conditions is because about 3/4 of a plate between the vegetables and the starches are plant-based. And again, it's a plant-based diet pattern. And the plant-based foods, as I mentioned in the last week, those plant-based foods have phytochemicals that are fighting inflammation. They have anti-inflammatory properties. The more plant-based foods we have, the more we combat that inflammation that happens in our body for different reasons. It can be because of environmental factors or stress or not exercising enough or not sleeping well, not just diet and foods that we're eating. Certain diets, very high in sugar and saturated fat, can be more pro-inflammatory for sure. But sometimes, again, inflammation can happen in our bodies for different reasons, not just because of our diet. And it's nice to know that with the dietary pattern, you have a way, you have a tool to fight that inflammation that can happen. So again, the diabetes, DASH, Mediterranean, they're all kind of plant-based diets. And I wanted for you to be familiar, because sometimes you might hear different, oh, for CKDs recommended Mediterranean or DASH or plant, and then maybe not knowing that, well, they're kind of in a way very similar, and they're all kind of good for CKD. So plant-based diets, vegan, vegetarian, Mediterranean, again, they're different options, have gained more popularity in recent years, the way I said last week. It's a diet that focuses on increasing the consumption of nutrient-dense foods derived from plants and limiting the consumption of animal-based foods. And again, the research findings, the more recent, is that it's associated with slower GFR decline and favorable kidney disease outcomes. It may help preventing, slowing the progression of CKD. And actually, there are some data showing the low intake of fruits and vegetables, so kind of the opposite of a plant-based diet, is associated with higher risk of kidney failure in US adults with or without CKD. And again, the conclusion is that this plant-based diet is beneficial for CKD. And I know a lot of you ask the question, what diet is good for me if I have CKD? Stage 1, 2, 3, 4. And this is kind of the answer, plant-based. And I want to go back to this. If I tell people, if most of the time, most of the meals in a week, 80–90% of them, they look like this, and they have 3/4 of your plate, 75% of that plate coming from plants, you are doing well. You know, sometimes even a third, which would be 66%, right? 2/3 of the plate being coming from plants. It's beneficial, and that's still part of the plant-based, because plant-based means more than half of the plate to be plant-based, basically. So again, the vegetables can be different with each meal, so you're not getting bored. The starch can be different, ideally something with fiber or more complex starch. Can be a whole grain like this brown rice here, or can be quinoa, or can be buckwheat, or can be whole wheat bread, or can be whole wheat pasta. Can be a starchy vegetable with fiber that can be potato or sweet potato or yam, or corn or peas or beans. And the lean protein, again, you know, we were talking about how much protein and how maybe some of you may need to have a bit less than 1/4 of like a 3-ounce serving per meal. Not always, you know, depending on your body weight. I showed you last week how to estimate your protein needs if you have CKD, to not exceed and not overeat protein, and that's based on your kilogram body weight. So people that are smaller frame, unfortunately, they have less room, and their protein portion should be smaller, compared with somebody larger frame that will have more grams of protein kind of allowed, and they could potentially have with each meal that 3-ounce serving without being too much. But lean protein, as we mentioned last week, can be chicken, turkey with no skin, fish and shellfish, eggs, low-fat, non-fat dairy products, you know, some lean red meat in moderation, and beans and tofu and nuts and seeds. So those are the main healthy lean type of protein. Going back to where we left, again, from the National Kidney Foundation, plant-based foods that are not highly processed, such as fresh vegetables and whole grains, have phytates. And we talked about last week in the context of phosphorus, that those natural phytates will bind the phosphorus that's also naturally occurring in a lot of foods. And then it binds that phosphorus and flashes it out through our stool, so we're not actually absorbing it in our blood to be processed by our kidneys. And then this will lower our phosphorus burden. We learned last week that phosphorus is one of the minerals that can accumulate in your blood as your kidney function decreases. It usually happens at more advanced stages when your body has a hard time to eliminate phosphorus, and that can affect the bone health. And also can create more calcification in your blood vessels and increase the risk of heart disease. So it's important to definitely not have this happening, accumulate phosphorus in your blood. And then the plant-based foods, as I mentioned, actually because of the phytates, can help binding that phosphorus. Now, I want to go into the nutrition. So I think I probably preached for an hour and a half or more about the benefits of a plant-based diet. So this is established. That seems to be the most beneficial for CKD at any stage, actually. And then again, the plant-based diet needs to be maybe twitch a bit, and as let's say somebody approaches kidney failure, and through medical management, phosphate binders or potassium binders, let's say those levels of potassium phosphorus are still higher. I mean, at that point only we're making some more restrictions of the plant-based phosphorus or potassium. Remember from last week, I say on a regular basis, if your labs are okay, and even when your labs are climbing up, if you're taking the binders and you're eliminating the processed kind of forms of potassium and phosphorus, those food additives that have potassium and phosphorus, that's actually the first step that we're taking. We're not adjusting and restricting fresh foods and vegetables because those natural potassium and phosphorus, as I mentioned last week, are actually poorly absorbed, so they're not as high absorbable as the additives ones, the ones in processed. So that's the first time to restrict in terms of diet. And again, if things kind of are not working and the binders are not working, then at that point in time, people may need to restrict. But it doesn't happen that often that that's needed, basically. With the nutrition label is in terms of making healthy choices to protect your kidneys. I always say when you shop and the product has a nutrition label, as a measure of health, like a healthy measure that we need to get, a healthy habit to get into, it would be to really start looking at a nutrition label before buying a food that has a label. This is a healthy habit. And then if it passes the nutrition test, you could buy it and have it and see if you like it. And if you like it, that's a win-win situation. That means that products you could buy and shop for on a regular basis. If you don't like it, then you kind of search for another one the same way. First, make sure it looks good on the nutrition label, and then try it at home. So the nutrition label, the first step is like you start here, you look at the serving size, what they tell you it's a serving, because all those numbers that are listed here are based on a serving, and you want to make sure you understand this serving makes sense for me. I would eat 1 cup of this product, or I would eat 2, or I would eat half. In this way, you kind of know, do I need to divide by 2 those numbers, or do I need to multiply by 2 those numbers? Because these numbers are based on just the serving. In this case, it's a cup. In this case, it's 2/3 of a cup. So basically, then you want to check the calories, especially if you need to manage your weight, or regardless, if you want to gain weight, more calories are good. If you want to lose weight, less calories would be better. So you need to glance at that to have an idea, is this a high calorie product or just a more lower calorie product? And then here we have the ones in yellow that we're supposed to limit these nutrients, the saturated fat, the trans fat, the cholesterol, the sodium. And then the blue ones are the ones that we want to make sure we get enough, like more fiber, more vitamins and minerals. And usually more, the protein here, it's kind of white, depending for CKD, you might not want as much. For other conditions, you might want more. But The rule of thumb is that for the ones that we need to limit, the percentage should be 5 or less, because that translates into low. And for the ones that are bluish, that we want to make sure we get adequate, we want a higher percentage, like 20 or more would translate into high. So we want 5 or less for sodium, for cholesterol, for saturated fat, and then 20 or more for the fiber. And again, possibly like calcium or other vitamins that we might need. So like if we look at this product, okay, so this one is 5% saturated fat. Okay, that's good. It's not high saturated fat. It's not going to be a food to increase my blood cholesterol and risk of heart disease. Sodium, it's 160 milligrams, 7%. It's not 5% or low, which this would be 140 milligrams for that to be 5%. But, it's still pretty close to, it's not 20 or more for sure. So overall, not a bad product. And then dietary fiber, 16%. It's not 20 or more, but it's not 5 or less either. So I would say it has quite a bit of fiber, this product. Has just 1 gram of sugar, 3 grams of protein. Again, that may work for somebody that limits protein. So I think overall this product may be, a good product for someone to try. Compared with this one here, and we don't know what those products are, but we're just kind of trying to make a decision based on the numbers, and for someone that has CKD. If somebody has also diabetes in this left example, 37 grams of carbs, I mean, 2/3 of a cup, that would be your carb for the meal. You might not want to eat other carb foods, because we want a maximum of 45 grams per carbohydrate, 45 grams of carbohydrates per meal. So it fits the budget, but you have to kind of make sure that you're not eating other carbohydrate rich foods with that meal. Now here on this side, saturated fat 15%, sodium 20%. So this product here definitely seems to be higher in saturated fat and sodium. Fiber 0, so no fiber. Again, we don't know what this product is, but doesn't seem as good or healthy for CKD and heart disease. So maybe something that we want to look for a different nutrition label, a different brand that maybe has better numbers. So moving forward, I think I said sodium 5 or less translates into low sodium, 20 or more, high sodium. Again, some people like to look at the milligrams, and some just use the percentages. But for sodium, 140 or less would be ideal. But I tell, in general, the rule of thumb, whatever it's under 200 milligrams of sodium per serving, it's still a good choice. Ingredients that have sodium will have salt, sodium, or soda as part of their name, and they might look like this, Ingredients: potatoes, soybean oil, whey, salt, dried milk solids, garlic, salt, butter, monosodium glutamate, dried oregano, sodium citrate, artificial flavors. And you could see in this particular ingredient list, we already have four of those names that either use salt, soda, or sodium in their it was actually just sodium and salt in this particular case, but sometimes like baking soda, for example, it would be something that will have sodium in it. But in this particular case, we have already 4 ingredients that signal salt. So then you would expect that percentage and that amount of sodium in that product to be higher. An example of a product, now we have the nutrition label, but we also have the picture of the food for you to see. This is sharp cheddar, a slice, it's a serving, 80 calories, saturated fat 20%. Yes, it's a full fat cheese. That's why we want to maybe get something at least reduced fat, if not even better, low fat, because that percentage will be lower. Unfortunately, any kind of different brand, if it's a full fat cheese in an ounce, you expect that amount of saturated fat. Sodium, it's 130, so not bad, not too high. No zeros, no carbs for diabetics. Protein 5 grams. Again, it's a protein food, but it's not too high. And again, overall can be something that we can use in moderation, maybe an ounce a day, so it doesn't add too much saturated fat to our diet on a regular basis. And you know, it's a animal-based food, so what other foods am I eating with this? You know, am I putting it this slice of cheese on a whole wheat bread, or making a sandwich with it with roasted vegetable and some pesto sauce and 2 slices of whole wheat bread and maybe a salad on the side, you know, something like that. Or, you know, how do I eat it? I eat it in a grilled cheese sandwich with nothing, no other vegetables, no other foods, plant-based foods. I have another example. This is a frozen meal, a cheese lover's lasagna, and this is the nutrition label. The serving seems to be a cup, so there are 2 servings per container. So that cup is actually half of the container. So this, they give you per serving the amounts and per container. So if you eat half or if you eat the whole thing, we could tell the saturated fat is definitely very high because it's also 3 cheese type of lasagna, so has quite a bit of cheese. That tells me sodium also very high. A lot of frozen foods, and this is what I wanted to make the point. Any kind of frozen food that's already prepared, just ready to be microwaved, will have quite a bit of sodium. I think the lowest I've seen maybe in the 300 something area, which is still considered higher, right? Over 200, but definitely would be lower than this particular example. Also, you know, protein, this is a high protein probably because it has a lot of cheese and maybe some meat too. So depending on what you need to, you know, restrict, if you need to watch the protein the way we talked, the saturated fat, the sodium, if you also have high blood pressure, it may not be the best food choice. If you also have diabetes, again, if you eat half with the salad on the side, may be better than eating the whole container. But overall, definitely, I want to make the point, cooking at home from scratch would be better than relying on any restaurant meals or prepared, frozen, or just bought out of the deli counter of different grocery stores. Because the way you could see, especially from a sodium perspective, those foods are very high in sodium. Phosphorus, I want to talk about nutrition label reading around phosphorus, because again, at any stage, I really recommend for people to start cutting back on phosphate additives. And you just need to avoid foods with ingredients containing phos in their names. So getting again into the pattern, not just reading the nutrition label, but the ingredient list. And those are some of the example of the food additives that are phosphate based that are found in our food environment. Calcium phosphate, sodium phosphate, monocalcium phosphate. And I'm not going to read all of them, but you see I bold here the phos. They're going to be a type of phos or phosphate in the names of those. So they're easy to kind of recognize. The new nutrition label, so this has been around for a couple of years or so or more, but the difference is that they tell you, they bold the serving size, because before the old label had the serving size was like a kind of hard to spot, and a lot of people would look at those numbers thinking that's for the same contain for the whole container, not paying attention that serving size can be different. And in this particular product, 8 servings are in a container, and 2/3 of a cup is a serving. And then they bold the calories to make it more visible. And then percentage here, I think the biggest changes that includes the information how much added sugar. So before it was just sugars, and you could not differentiate between natural or added sugars. And right now, basically, they tell you the total sugars, and out of those 12 grams, 10 of them are added. And just 2 grams are natural sugars. The rest are added. Before, they're all clumped together. You could not tell how much is added sugar versus natural sugar. So this is a big advantage right now, that we could figure out how much that added sugar is in a product. I want to talk briefly about portion sizes, especially for protein. I have an ounce of cheese here, that this is how kind of how it looks like. An ounce would be 3 of those slices. A protein, about 7 grams in an ounce of cheese. Sodium can be between 180 to 480, depending on the type of cheese. So again, if it comes packaged, please look at it. Not much potassium and some phosphorus, but again, this is less important for most of the CKD patients. And moving forward, 3 ounces of chicken, deck of cards. You have an example here for salmon, for chicken, how that can look like based on how thick or how thin a slice is. It can look different ways. Since we talked about that there's no big budget for protein with the CKD diet, I say a lot of people like to thinly slice things, so then it looks like more, or dice. Let's say you put some chicken in a salad and then you cut it in smaller pieces, so it kind of spreads more in the salad, and you could take a bite of chicken with almost every bite of salad, versus you create those bigger chunks. And half a cup of cooked beans, 7 grams protein. This is plant-based protein. Again, if cooked without salt, no sodium, has some potassium and phosphorus, but as I said, that's not very relevant. And then nuts in an ounce or a quarter of a cup, you have 7 grams of protein, 5 to 7 depending. And again, not much sodium, some potassium and phosphorus. That's not important. Why meal planning is important for people with CKD? Like with any kind of, if you are diabetic, or if you want to lose weight, or if you want to manage a chronic disease like CKD, you want to be prepared. You can, this way you could choose the foods with less sodium. You want to, again, have a shopping list and shop for things and look at the nutrition label. It helps you make better choices when you plan ahead of time. And you could change your meals and modify those meals with little preparation and planning. You could actually make them better for you. The first thing, you want to have a regular grocery shopping day at least once a week. You want to look what's already in the house and plan your meals around what you have on hand. Ask other family members for meal ideas. Be realistic about your time. Maybe having something, cooking more in batches to have leftovers. You don't have to cook every day. You could cook in batches and have maybe 2-3 meals out of one cooking experience. Reuse items for multiple meals, like you roast a lot of chicken and then you use those smaller amounts of protein in different dishes throughout the week. You could freeze some extras when you do the batch cooking. And again, read the nutrition label. It's there for you to kind of educate on what's in the food that you're buying. Some tips with behavior changes. I said change sometimes it's hard. You need to embrace it, and you need to allow some time for that to happen. I don't believe in those change your diet overnight. I see them working, but temporary. People get frustrated sometimes and just give up. So I feel like people do better when they embrace the change and they make change a little bit more gradual. You create realistic and achievable goals. You break a bigger goal into smaller goals. You might say, I want to cut back my saturated fat intake, and then maybe the first small goal or the first small step would be I'm switching from whole milk to 1%, So out of that big goal of reducing saturated fat. You want to start with a goal that's easier for you to do because you want to be successful, and then you want to be able to build on top of that and continue with the changes you're making. You don't want to start with the hardest thing to do, because then it might be challenging. Use tools for accountability, professionals like working with a dietitian, for example, or having friends to keep you accountable, doing journaling or using apps to track food or activity. Again, meal planning is very important. You want to put some time into that, so then you're prepared and you're not just right now hungry and figure out what you're going to eat. Meal predictability, it's important too. So having regular meals and knowing when you eat, as opposed to just waiting until you get hungry or you have time to eat, that usually leads to irregular meal patterns and unhealthier food choices overall, because you're gonna have to decide on the spot when you're hungry. A clean food environment at home and work. So trying not to make your life harder. Like if you're trying to make those diet changes, you don't want to keep buying and having at home foods that are not really good for your kidneys, right? Because those temptations are going to be harder. And even if you think I'm not going to eat it, you're probably still more tempted, and you're probably still going to end up eating those foods more often. So trying to set some limits and not having a lot of things on hand that you're not supposed to be eating. And then have some plant treats weekly. That's very important with any, I say with the plant-based diet, even this is the majority, 80-90% of the time. So you don't have to completely 100% follow. Nobody has that perfect diet every single day, every single meal. And 1 or 2 meals in a week, I tell people, they can be exceptions, they can be, and then that's your opportunity to use the treats on a weekly basis. Is not what happens the majority of time, but you have room for them. And then I want to show you also very quickly, and I have a few more pictures with meal examples, and then we could actually move to our guest speaker and hear more from his experience. But this is planning a 7-day menu can be overwhelming, right? So you could start with just 3 days. For example, you plan Monday, Wednesday, Friday, and then you have leftovers, and you could actually fill in the gaps. This is just an example from the Vida. I didn't put it together, but it's basically an example of, you could have 3 cooking experience in a week, and then with the leftovers and with some other things that are either easy to put together, or you can eat them, let's say yogurt or peanut butter, or sliced bread, or things that they don't need to be cooked but can create the meal. You could actually fill in this meal planning kind of sheet without having to cook every day for every single meal. So you need to make it easy for you. And I want to give you some reference ideas here. We have some examples: oatmeal and nuts and fruits, avocado toast with some eggs, with a hard-boiled egg, and then this frittata with vegetables, egg muffins, actually they're called. Some examples for lunch: vegetables in pita pockets or tacos, or minestrone soup, the chicken salad, the pasta with veggies and a little bit of protein. Some dinner examples, more plant-based. You could see here the garbanzo, buckwheat, and some vegetables. This is more like a 100% plant-based type of example. Salmon with salad, and again, like a burrito bowl with a little bit of chicken and some corn and black beans. And the last would be some examples of snacks: tuna, cucumber, walnuts, and many more. I wanted to kind of cater to different tastes, but this is what I have for today in terms of meal planning and meal examples. And I think our guest speaker is ready to take over. Thank you so much.
Great, thank you, Elena. And I think Dr. Mouratoff is on. And I want to do a little short introduction before we get to a little discussion with him. Dr. John Mouratoff is a nephrologist in the Oakland, California area, affiliated with many hospitals in the Bay Area. He received his medical degree from Drexel University, College of Medicine, Hahnemann University, and has been in practice for more than 20 plus years. Dr. Mouratoff, welcome. And could you expand a little bit more on your professional experience and all the wonderful knowledge that you bring?
Yeah, so thank you, Franco. Thank everyone for inviting me to this. I'm really passionate about nutrition and medicine. I think that's one thing that we honestly weren't taught in medical school, and I'm learning right now on a daily basis. I actually went to UC Berkeley. I'm a Cal alum, and I started my training in Philadelphia, but I finished at UC San Francisco. And at that time, when I was at UC, we're actually taught that dietary manipulation doesn't change outcome. So it was a very sad day. It was basically 3 years after a huge study called the Modification in Diet and Renal Disease, or MDRD, came out. Unfortunately, they made a mistake in the study. When they went back 3 years later, they looked at it and they discovered that actually dietary intervention does make a difference, a profound difference. So that's not how I came of it. I came of it with working with a patient. And this was a gentleman who had diabetes, chronic kidney disease, stage 4. In fact, by the time I found him, his GFR was 16. And as many of you know, that's very close or approaching dialysis. And so I went through, what can we do with your GFR? Well, we can talk about dialysis options such as hemodialysis, peritoneal, and so on, or transplant. And he looked at me and said, Doc, I don't like any of those options. Is there anything else I can do? And I remembered my training. You know, I learned a little bit about nutrition from Dean Ornish and plant-based diets to reverse cardiovascular disease. And then I had an experience of one patient who's Filipino, and he's in the Philippines. They eat lots of vegetables. And he was able to keep himself off of dialysis for a year or two. So in this guy with a creatinine of 3.4 and GFR 16, I said, well, you could try a plant-based diet, but honestly, I didn't expect to see anything benefit from it. I was, hoping that we could slow things down, but not certain. He came back 4 weeks later, and his GFR went from 16 to 50. His creatinine went from 3.4 to 1.6. And honestly, it was so good. I thought I had the wrong labs. I said, please, I want my secretary to check to make sure it was the right patient, because I'd never seen such a dramatic response to dietary intervention in my life. Now, true, he had stopped nonsteroidals a few months before. His blood pressure was controlled. He was on an ACE and ARB. All the other things medically were done, However, this was profound. So I didn't believe it. I said, hey, wait, please come back in another month because I'm not sure this is real. And I repeated it, and it was better the next month. So I really started scratching my head. And this was back in 2014, about 14 years after my training. So I went back and looked at the literature, and actually the older literature shows this, that diets really do make a difference. And even the Journal of Renal Nutrition talks about the primary manipulation for chronic kidney disease should be a dietary approach. So somehow we forgot this. And that's what I've been working on for the past 9 years with my patients, is trying to remind them that diet makes a difference. And that's the message I have for all of you. The big question is, hey, what can I do to change my outcome, right? Can I at least delay being on dialysis, or can I avoid dialysis altogether, right? And I think a lot of that control is in each individual's hands. Now, it's not easy. I forget who is quoted as saying this, but it said that it's easier to change a man's religion than to change their diet. And I think, Elena, you're talking a little bit about that. And the dietary change going from a plant-based diet, or from a regular American or SAD American diet, right? Standard American diet, which is SAD, to a plant-based diet is really drastic. However, I've discovered that nutritionists are my best friends, and there are lots of them around. And, we're all together. So not only that, I had to go on a vegetarian diet myself and go vegan in order to train my patients. So having done this now for 9 years, at first I was doubtful. I thought it was a fluke. But now it is real. It's an amazing story for this one individual, but I've seen many other people come back from the brink of renal failure. Now, some others don't. I would say the majority, it helps considerably by delaying the start of dialysis by 2 to 3 years. That's a lot of time if you think about it. right? In 2 to 3 years, you could get a transplant. Or if you're really interested in home modalities, you can learn about PD. Now that's some people. There are exceptional people who completely turn around their disease. And this is people with creatinines of 1.5 go back to less than 1, right? On a vegetarian diet. So it's really unclear to me. I think the key is you don't know until you try. And what I've discovered is if you try for a month, it makes a dramatic impact in your health. So not only is your energy level higher, your creatinine's lower, your phosphorus is actually lower. Thank you. That's another benefit of plant-based diets because they have different kinds of phosphorus. And we were talking about that. People lose weight. People's blood pressure gets better. So there are a lot of other factors in going plant-based that are beneficial for almost everyone. And in fact, that's why I'm back to plant-based myself. I have to practice what I preach. And honestly, COVID made me go off the deep end. But I'm back. I'm back one step at a time.
Quickie question as you were speaking in terms of the patients that have that you've come across, and I'm sure there are many that have gone into a plant-based diet. Did they need or require or ask for the support, the conversation with the nutritionist, family member that can that would guide them in terms of just kind of managing the whole shift from their normal diet to now this different type of way of eating? And how did that go for them from those individuals that you've experienced that change with?
Yeah, so 100%, no one can do this by themselves. And the first individual, his wife was a nurse and a nutritionist. What a perfect situation, right? Ever since then, I try to get every patient to see a nutritionist, and some really connect. And in fact, they like the nutritionist more than they like me. They figure that they're the ones who are doing the work, which is fine. I like sharing, right? I've also worked with a company called MetChef, and that company created a Mediterranean diet app. And I told them I really like the concept of the app and having support in nutrition and also meditation and mindfulness to assist with behavior change, because that's what we're really talking about is a huge behavior change. Initially, it was only Mediterranean, but then we made a vegan or plant-based component to it. And that helped them a lot. However, we realized the app alone wasn't enough. It was the support groups that made the biggest difference. So we started having weekly support groups, and then patients can share their stories, right? And family members are highly involved. I actually have a lady and her son, and the lady is in her 80s and her son's in his 40s, and they're plant-based, and he supports her. And he said, oh, by the way, my cholesterol is better now too. Thank you. So there are all these added benefits. And I think you're right. It does take a village, and it does take people to have support. It's really challenging by yourself.
Yeah, one of the things that we deal with when we do a lot of the patient education opportunities that we have, not only with persons like yourselves, but some of the other providers that we work with in the local communities, you try to provide them with the basic information to help them develop better meal plans to kind of fit their medical conditions as best, to match it with the food consumption that they're practicing. And sometimes we forget that individuals don't necessarily live alone in a silo, so to speak, that they also have to kind of think about the rest of the family. And when it comes to the women or the individuals that are preparing foods for not only themselves, but the rest of the family, I would assume that there's a conversation that needs to be had with not only the individual that is pursuing the shift, but also the rest of the family that is under the same roof to kind of provide the maximum benefit.
Well, it's really interesting you mentioned that. There was a research study in Texas, and in Texas they were looking at the difference between a plant-based diet, and that's adding fruits and vegetables, not just plants. So just mind you, this is Texas. They can't get rid of meat there. So what they did is they decided to bring boxes of vegetables, enough for the entire family to eat, to everyone in the study. And then they had another group that was just getting standard care, and a third group that was getting sodium bicarbonate pills to correct acidosis. The outcomes were much better for those on bicarbonate and adding vegetables. So vegetables are alkali, and Elena, you know that, and you guys know that alkali is beneficial for the body. It gets rid of acid. It buffers. So just that alone was enough to delay progression. But you're right, they had to get the whole family on board. So I couldn't believe that they bought enough food for it to feed. And if you had 4 people in your family, that's how much food they had. You had like 3 or 20, they brought it all. So it's important. Again, it takes a tribe to do this. By yourself is really challenging. And what we're fighting is an institution of habits. All right. And changing one's religion isn't easy.
Yeah.
Yeah.
I
But this,
have a,
based on the fact that you have gone through it and practiced yourself, I was curious to know if there were any, if you noticed any changes or differences in the first few days as you're getting into the new habits, the new different way of eating that sometimes people talk about that say that they feel a little bit different, maybe more or less energy, they're able to do that kind of stuff. It just kind of, any comments or experiences that you yourself have lived through or that some of your patients have mentioned in terms of that shift that happens, good and bad, as you're going from one type of eating to another.
Well, I tell you what
Other than,
really motivated me to go back to the vegetarian diet is someone I saw recently who's a family friend in her 50s and a tennis player. And she was having a lot of arthritis and chronic kidney disease. So she came back about 6 weeks later and the arthritis was gone. She's like, I've never played this great tennis. I have so much energy. And she had lost not much weight, but she looked different. She looked very youthful. And I'm like, boy, I want what she's got. That was brilliant. So I'm like, I have to practice now what I preach. And I went back to it. And honestly, I gave up coffee at the same time. So here I am, somebody who's been drinking coffee steadily for 5 years. I have enough energy that I don't need it. I drink tea. I'm not completely caffeine free, but I have that. And it's minor things like joints. And some of this could be inflammatory disease. Like some people have issues with dairy or with gluten, and that can cause joint problems. But I'm telling you, for most of my patients, their joints get better. And so getting over 50, you have joints and you know it, right? So that's a huge part. And the energy level to go out and play pickleball or, go for a walk with your kids and go skiing and do things like that. That's really what we're talking about. It changes your life. So it's not just the creatinine and the numbers, it changes how you feel.
yeah, the quality of
fantastic.
life. And I have a question regarding the patient you described at the beginning. So it was when you said plant-based, because I know, and I talked last week to the plant-based umbrella. It's big. I mean, can include vegan, vegetarian, but also can include, more like a Mediterranean diet, which the portion of, let's say, chicken or even red meat protein is very small. So was he going vegan when he had that? And even from experience, because I saw some research studies showing right now that at least like 70% of that protein to come from plants. Do you have any data to say 100% like vegan would be much more beneficial for CKD versus plant-based that can be, let's say, 70% of protein plant-based?
Okay. Well, I can answer both parts. So part one is in this individual, he actually thought I said a no protein diet. So he went completely vegan, absolutely vegan for the first 30 days and then 2 more months afterwards. After that, he reintroduced sausage because he loved it. And he would have some sausage every 2 weeks. The second part is Dr. Kalantar has done the Plato diet, which is mostly 70% plant-based. He shows, though, the higher above 70%, 80% and 90%, you get more benefit. Probably the best study that I can talk about is the one from Romania with Garnietta, where she looked at protein restriction on a regular low protein diet, which is 0.8 grams per kilogram, comparing to, oh my God, my neighbor's working here. Hold on. I have a brand new neighbor who's building a fence. So sorry, I apologize to everyone. So Garnietta had a protein restriction, which is what we learned in school, 0.8 grams per kilo, which is the size of the palm of your hand of protein a day, versus a very low protein restriction, so 0.3 with keto supplements, and those were all vegan. And the number needed to treat to keep one person off dialysis was 3. That's with a GFR of less than 20. That's really powerful. So I think there's additive benefit to going more vegan, but it depends on where you are in your stage. And certainly, if your GFR is under 20 and you're very close to dialysis, you have to do something more extreme to turn it around. You don't have time. Whereas if you have early chronic kidney disease, let's say stage 3A or 3B, you can try just reducing and going to 70%. I think that's beneficial. I've seen studies that show that it's really the red meat that causes the most trouble. So typically I instruct people who just want to try to remove red meat, so beef and pork, and then continue fish and chicken. And then the next thing I remove is dairy. And then if they really want to go all out, it's challenging because with vegetarian diet, you have to give supplements, right? You don't want to miss out on vitamin D and iron and omega-3 fatty acids. So fish oil, I also supplement with. So I've learned over years how to take care of people who want to be 100% vegan because it's not easy. And the only way I could do that is learning it myself, right? So starting off with everywhere I go, I would have oatmeal because you can just bring a packet, add some water, and there you're on the plane, you have a meal. So I think having meals, having shakes, Impossible burgers have changed my life. So if you have that feeling that you need a taste of meat, and I know you, Elena, you're going to say they're high in salt, or Franco, you might say that they are, but it's a good salt. It's a good kind. So the Impossible, for people who just want to have the flavor and be with family in a barbecue, this allows you to socialize what you do. There's also sausages that are plant-based. So I think we live in a time that actually makes it a lot easier to go plant-based than decades before.
Yeah, it's true. And I was actually talking last week about those are good options when maybe not your daily protein choice because of the sodium, but you could have it once a week just because you want to, again, reproduce some dishes that traditionally you ate with meat, also to be part more of social events and to avoid the taste fatigue. The plant-based protein, unfortunately, it's limited to few choices only, and having more variety, I think it's a good thing.
Quickie question. You mentioned that as somebody goes into a more plant-based food consumption, that you have a tendency to consume more basic type of foods. Is there anything within the regular follow-up care laboratories beyond the GFR that a patient should look out for or kind of focus on as they're on this particular type of food consumption for a short time or a long time?
Franco, that's an excellent question. You can look at the serum bicarbonate, and normal range is anywhere from 24 to 27. And a lot of people with chronic kidney disease, they get a metabolic acidosis, so the bicarb falls to 20. And I see most between 20 and 22. When you change your diet to plant-based, that bicarbonate level goes up to 24, 26, 27, even up to 28. So you can use that. And I look at that to track if somebody's actually compliant with the diet, because I know if they can get their bicarbonate up, they're eating a lot of alkali, which are plants.
Thank you. That's very important, very important. And then a little, one of the conversations I had with one of the individuals that we see in some of our education pieces, you always kind of get some comments about some of the myths around food consumption as a whole, but in particular, certain types of diets that people like to follow for certain health conditions. And I was just curious to know if you had come across any myths that we can talk a little bit about, maybe correct in terms of the consumption of a plant-based food.
Oh, I mean, I'll tell you, I came from a family with two physicians, right? And they were trained in Greece, and they actually survived World War II, right? And there was a German occupation at the time, so they made it out of that. They believe protein is king. So I remember personally when I went on a vegetarian diet, my mom said, "Johnny boy, you're gonna die. You can't survive. You need to eat meat." Literally, quote unquote. And I think that's a misconception that meat is the only kind of protein. I think that's something that's really in our community and people understand. The other thing is not understanding what vegetarian means. I can't tell you how many people eat chicken and think it's vegetarian. So I have a little mantra where I tell people if it has a mother or an eyeball, it's not a vegetable. Just to get them back on track. Like, yeah, I eat shrimp. That's healthy, right? Like, sorry, it has an eyeball and it was born. So I think part of it too is just, having fun with people. We're all learning. We're all learning for life. And certainly this is a big change. So I try everything I can to make it fun and to kind of meet people where they are. And yeah, so I think that's one dietary misconception. Honestly, as a nephrologist, we weren't taught about diet at all. So I imagine that maybe the majority of nephrologists in my era, and I'm dating myself because I graduated in '99, but we weren't taught that diets were important. So you may go to talk to your nephrologist and they have a blank stare, right? And they don't have a nutritionist to refer you to. So it's important. There's a lot of information on the internet, which is beneficial. I think your site, the NKF, is one of them. ASN is another. Dr. Kalantar does a lot of work with Plato diets, which are mostly plant-based. He was actually a fellow with me at UCSF. It's actually rather ironic that
Wow.
20
And
years
believe it or not, he's a
later,
good friend of our organization.
yeah,
He's quickly at
he's
the
amazing,
UCI, which
and
we haven't
he's
talked a lot about.
published.
You're
He
correct.
actually published
Wonderful.
something in the New England Journal. So part of it too is we have to re-educate ourselves as physicians and educate patients. The funny thing is I find patients are more likely to change their opinion than doctors, right? Because patients can see the change immediately. As you said, once you start eating this way, all of a sudden you feel better. Your energy levels go up, and you can see little things like your blood pressure go down, and you can see your creatinine improve in just 30 days. So I think that's really good feedback for most, and always worth a try, right, to see if it's for you.
Exactly. And another related question is, at what point should a patient maybe ask or request a collaboration partnership with a nutritionist in the event that currently, as it's being treated, that they haven't been able to consult or ask questions more directly, specifically about their meal planning with the nutritionist in their course of treatment at wherever health plan or facility they're at? Is there a point where you say at the beginning, the middle, or after certain laboratory results? Is there kind of a general recommendation that we can give to our audience?
Yeah, in general, it appears that any stage of chronic kidney disease can benefit from nutritional intervention. So early stage, 3A, 3B, 4, and even 5. So the only people I see that have the challenge with changing diet that may not benefit are those who are already on dialysis. That's the only time, but you're going to see a nutritionist anyway because you have to lower your serum phosphorus and salt intake and look out for potassium. The big markers. So I would say almost everyone throughout stages benefits from talking to a nutritionist. There's actually data. They show that a patient with any stage of chronic kidney disease who's seen by a nutritionist, it slows down the progression of their disease, right? So I think just learning proper behavior, and that's not a plant-based diet, mind you. That's just any nutritionist. So I think there is so much going wrong with our diets in America, and that it's important to meet a nutritionist and find out, kind of like meeting a coach, what you're doing right or what you're doing wrong. I play pickleball, and I'm terrible at it. And it took me a while to realize it. And my friend hired a coach. He's like, oh, you're doing this wrong. So you just can't see it yourself. It's really nice. And I look at a nutritionist, and actually I look at my role as a physician, as a coach, to help people align to the lifestyle that's better for their health.
Fantastic. And any recommendations on how to help or push people to get started on a plant-based diet for their treatment plan, where they even be with the health condition?
Yeah, so with or without physicians, there's lots of resources for plant-based diets. One of my favorites is actually Forks Over Knives, and there's a video you can watch that talks about it, and there's a cookbook, so it's a good way to start. I like videos because they're motivational, and Forks Over Knives shows how changing the protein content of your food can provide health. The other one is Dean Ornish. And Ornish has Ornish Living and Ornish Lifestyle. They're also plant-based. So those are great resources and cookbooks. And then the one I've been using lately is MedChefs, MEDCHEFS. And it's an app as well as an online site. I think they charge maybe $14 a month. And it's a support group too. So there's benefits beyond just cookbook. Now, that's the beginning. I think it's important to meet up with a nutritionist at some point, maybe not at first, but just to make sure you're eating right. Because I think the worry I always have is that people restrict too much, right? And may not be getting enough calories and could suffer from malnutrition. So that's why it's important that any diet like this be supervised. So to answer your question, I think pretty much everyone should at some point meet a nutritionist just to get cues and make sure they're eating healthy.
Fantastic. Good recommendations. And I think that's all the questions I had, me personally, and I don't know if Elena has any additional thoughts or questions for Dr. Mouratoff. Elena?
I think we had, and maybe Lily, you can help with that, because I think there's some questions in the Q&A section.
Yeah, so it looks like we have quite a few questions. We have a few in the chat and a few in the Q&A. Just to keep myself organized, I'm going to start with the ones from the chat, and then we'll move into the Q&A. The first question, and this is open to any one of you to answer. Can you provide some comments on MSG? And this was asked back during Elena's presentation, so it may be a little bit more related to those topics, but everyone's welcome to answer.
Elena, I'll let you go.
Yeah, so, MSG, monosodium glutamate, had kind of back and forth, like a really bad reputation a few years back now. It's, the latest kind of news I read on MSG is like, it's not that bad for you. Overall, it's monosodium glutamate. So it's something that adds sodium to your diet. So it depends on the product that you consume. It tends to be more in processed foods. So I would be kind of careful with, how much sodium, how often I'm eating that product. But I don't have any specific kind of information that, let's say, MSG in particular will affect differently your chronic kidney disease than, let's say, any other source of sodium. So this would be kind of my answer. But, overall, as we talk, you want to watch the sodium on a kidney diet, especially if you have also blood pressure. So it's something definitely to not eat liberally.
I agree, Elena. I think it's a hidden source of salt, right? It's not obvious. And it's a flavor enhancer, so we can over-enhance. Typically, you get these in Chinese restaurants. That's where a lot of MSG was used. I know a lot of restaurants now actually publish whether they use it or not. And so it's nice to see that. Aside from that, some people get sick with MSG. So
more sensitive, yeah.
Yeah, so some people are more sensitive than others to it, and it's very artificial. So I'm not really a big fan of it. However, a little bit once in a while when you go out to dinner is fine, just not all the time.
Great, thank you both for sharing. On to our next question. In general, what do you think of meals that are delivered? This person is trying a plan called Meal Pro. There are different menus for different stages of CKD. They have 10 meals and are very tasty. They are fresh and are cooked at home. They are not plant-based, but I am eating breakfast and lunch plant-based and will eat the delivered food only for dinner.
I'm not familiar with the program. I mean, the meal program itself to know, but it seems based on what the person said that's catered towards CKD and different stages. So, I would like to look definitely each time one of my patients will bring up, I'm using this, I kind of search and look at the nutrition information of the meals they provide. So it's hard for me to say if it's good or not. The fact that it's catered towards CKD in different stages, it's a good sign that hopefully it's, appropriate for CKD diet. And they have maybe a nutritionist on staff that looks at that nutrition analysis, but I can't say more. I'm not familiar with it.
Yeah, I'm sort of in the same place with you. I don't know that particular service. I've used one called Thistle, THISTLE, and that's plant-based. So I found that, and you get, again, you can choose how many meals a week you get. You can do it for breakfast or for dinner. I chose dinner. because it's easy for me to prepare a vegan or vegetarian breakfast. I think the key is whatever is in that meal, that you look at it for the content of protein. And it sounds like if it's already adjusted for chronic kidney disease, they're probably sensitive to that and are restricting. But I would say the next level is make sure there's no red meat. So beyond just a protein restriction, just make sure there's no beef or pork in it. Because there is data that shows that beef and pork accelerate renal injury. The other part too, and I should tell, going back to my original patient, he was on an Atkins diet originally. So we've also learned what diets are really bad for chronic kidney disease, and those are high protein diets. So if anyone's thinking about a keto diet, which I know people do, and actually my son did to lose weight, you have to be very cautious that they're not high protein, because that can actually be very damaging to one's kidneys. It can accelerate injury. So as long as the protein restriction is intact, we eliminate red meat and beef as much as we can. I think, having that as one meal a day is a good start. And, it builds the habit for change. Once you learn how to cook on your own, you may not need it, but it's a good start to changing your lifestyle.
So thank you both for your input there. One more question from the same person. What are recommended daily amounts for sodium, potassium, and phosphorus?
I think, the cardiac diet is 2 grams of salt or 2,000 milligrams, and 1.5 or 1,500 milligrams would be even better. Potassium, I've been all over the map on that. If you have a high potassium, and you may know this, each individual has their labs. If the potassium is high, you need a restriction and maybe a 2-gram potassium. But most people, even in stage 4 CKD, don't have high potassiums and do fine with up to 4 grams of potassium a day. Phosphorus, unfortunately, I just don't know the numbers. Elena, you might be better at the numbers on phosphorus for exact amounts to restrict.
Yeah, it's between the range is for 800 to 1,000 milligrams. So you want in grams, it's 0.8 to 1, but usually the phosphorus will come in milligrams when you search for phosphorus levels of different foods. So 800 to 1,000 milligrams of phosphorus a day when you need to restrict.
The thing I find challenging though is most labels don't include phosphorus, right? They have sodium, they have potassium, and phosphorus is always left off. So you have to understand where phosphorus is coming from. My favorite soda used to be Coca-Cola, and that's the highest for phosphorus. And then realizing that cheese is really high in phosphorus, and nuts. Even though nuts, you would imagine nuts are very healthy, but peanut butter and almond butter is very high in phosphorus too. So as long as you're staying away from the really high sources of phosphorus, you're okay. The other thing is foods are prepared with phosphorus. So if you go out for fast food, they've actually shown if you get a chicken sandwich yourself from, let's say, Lucky's or Safeway, it has half the phosphorus that if you get it from KFC or Church's or one of these prepared restaurants, because they add phosphorus to enhance the flavor. It's sort of like MSG to make it taste good and make it stay from spoiling longer. So I think that's important too. It's not in the label, but there are certain foods you really can stay away from that you should avoid.
Yeah, and as we mentioned during the lecture, the phosphate additives are kind of the worst and the most absorbable. So they will impact your blood level of phosphorus the most than the ones in animal protein, like red meat and chicken and other would be kind of also more absorbable, not as highly absorbable as the phosphate additives, but still. And then the plant-based, the ones in beans or whole grains or nuts and seeds would be less absorbable, which they might impact less. So it's, as I mentioned, some people may need to restrict those, but those would be the last foods to actually restrict, the plant-based phosphorus foods. I would start with the top ones, the phosphate additives, the meats, and then going to the plant ones, kind of last resort.
Great, thank you both. Next, I think Dr. Mouratoff touched on this a little bit in the previous kind of Q&A section, but recommendations on how to get your nephrologist on board with a nutrition referral.
Yeah, I mean, data always helps nephrologists. You know, we love evidence, and there is evidence now. So you can look at New England Journal of Medicine, and there's Cam Kalantar, my co-fellow, and you guys know him well at NKF. There's articles there, or you could say, look, I heard this nephrologist talking on the webinar, and he said that diet is really important. How can I meet a nutritionist, and would you help me explore nutritional intervention to help protect my kidneys?
Awesome, thank you. That finishes out the chat questions. Now we can move into the Q&A. This one is, do you provide an extensive list of foods low in purines?
Typically, unless someone has gout, I don't necessarily do that, right? That's the biggest concern. You know, if someone has gout, I will give a handout. I use UpToDate, and they have a really nice chapter on low purine diets. But ordinarily, I don't think it's necessary. Purines come from amino acids, right? And nucleic acids. And so if you're eating a lot of animal protein, you do get more purine. For example, if you're eating organ meats, and if you're eating shrimp and drinking wine, that's a high source of purine. So I think automatically changing to plant-based, the purines are low. In fact, I've had several patients come off of their gout medicines because they changed their diet. So typically I don't give handouts for purine unless someone has gout and then they're interested in reducing the risk of having more flares.
Yeah, I definitely agree. And but I have we could send it after maybe when you send Lily the information after the lecture. I could share the handout that I give to patients that have gout and need to reduce the purines.
Great. Yeah, that would be great. I'm happy to include that in the post-event communications. Our next question, I would like to know the proper diet to keep my GFR above 30, which is where I'm at now.
I think we kind of touched upon that.
Yeah. I think, you know, eat whole foods, mostly plants, and not too much, right? That's a classic quote. And I think that's still true for this. There's no one diet for each individual. It has to be individualized, right? And so the diet that you can be happy with and is sustainable is the most important one. And if that's 100% plant-based, that's great. But some people can can't do that. And so at least 60 or 70%, there's a benefit. So I think there's not one answer for that. It really depends on where you are. At CKD stage 3A, or on the cusp of 3A and 3B at GFR of 30, you could go either way. I think it would be important to eliminate red meat first, right? As we talk, like eliminating cheese and eliminating deli meats would be a start, and see what happens. And if you need to do more restriction, you can always take off more later on. But I think just with that, you'll see a difference.
So thank you both for kind of reviewing that from the previous presentation. This also, I believe we touched on it, but how do you eat a diet that is good for both CKD and diabetes?
Well, I'll say a little bit about that. So traditionally, plant-based foods are high in carbohydrates, right? And so there's a worry that your diabetes may worsen as you go plant-based. But it's important to, you know, balance it out with fiber. So if you're eating highly fibrous foods, it actually slows the GI absorption and will block the absorption of sugar. So rice and beans is a good example. Rice is high in carbohydrates, so are beans, but the fiber in the beans slows things down. So I think working with a dietitian, you can, certainly this is an instance where you have to, right? You could go home and say, hey, they said eat watermelon. Oh boy, my blood sugars are now 600. That wasn't a good idea. So it's important to balance it out. So some plant-based foods have high glycemic indexes and one should avoid. Others are actually pretty moderate glycemic index and would be safe. So this is really an individual thing depending on your situation, and you know, how you deal with your response to sugar, for example. So if you eat rice, some people spike with rice, but if you change from white rice to brown rice, it doesn't happen, or the spike is lower. Exactly with beans too. Beans can slow transit. Blueberries are also quite good for you, even though they're very sweet. They have enough fiber in them that they slow the absorption of the sugar, so you don't have a glucose spike. So I think it's important. Like, and some people are different, where a blueberry might actually spike it. So it's important to see what happens and measure it, and do it slowly with the assistance of either a physician or a nutritionist to be sure that you're doing it under supervision.
Yeah, and that my plate model of eating that I showed you earlier, that was also a carbohydrate control kind of pattern. That's a good guide for your meals. Still plant-based, 75% of the foods on the plate can be plant-based, and but carb control too. So that's a good visual for you to use.
Great, thank you both. Those are some really great tips. On to the next one. Do you have any recommendations for resources to help patients meal plan?
It depends what you're looking for in terms of if it's more, I want to learn how to cook, or I need more ideas how to make my food more interesting, or the vegetables or whatever. You know, there are lots of resources. The USDA had this nutrition.gov food shopping and meal planning, and they have different sections. Like, it can be things around maybe nutrition on a budget, or shopping to get organized when you shop. Kind of they have my plate tips and other things, like depending on what you need in terms of help with meal planning. Is it more shopping or cooking or structuring your meals, or sticking with try interrupting this behavior of irregular meals, I eat whenever, whatever. So, you know, from my experience, people need help in different areas. And again, I would say that's a good starting point. That if you do a search, this USDA nutrition.gov meal planning and shopping tips page will come up. And again, they have different sections that you could click on based on what you're looking, what you need.
Yeah, the two apps I like for this, there's one by Physicians for Responsible Medicine, and physiciansforresponsiblemedicine.org. They have a free vegan app. So you can download it to your phone, and it gives you meal planning for an entire month. So that's for free. Also on the Physicians Committee for Responsible Medicine, they have menus and other dietary items there. So it's all for free. It's been put out for about 2 decades now. It's by Neil Bernard, and he also has books on how to reverse diabetes. So that's the interesting thing. These also work for diabetic patients. So that's one. And then MedChefs is another one. And you can find that online too, and through the App Store. And it also has meal planning. And you can choose if you want to have 100% plant-based diet or a Mediterranean diet. So chicken and fish, for example. And it actually has a shopping cart that's built into Instacart. So you can pick what you want, and it'll be delivered to your home. So I think that actually will get you to the next step. You know, you have the idea. What is that book, Atomic Habits? You have to break it down into small parts, right? So the first part is, you know, you get the app or you get a cookbook. The second part is you start ordering the food and you come up with a meal plan. I think definitely that's the right way to go.
Yeah, I was just going to mention that in the general sense, for more generalized food information, we do have a good section on our website. It includes some individual recipes that people can utilize. And then also kind of want to recommend some of the bigger sites that may not be too specific in terms of their meal plan information, but it's good basic nutritional information that people can use as they go from one meal plan to another, to remind them of what the basic nutritional values and things that they should look at in a meal plan. And I'm talking about NIH, CDC, some of those websites that people can just kind of glance at and compare. And also, if you're able to access some of the health plans, like a Kaiser Permanente. I found that in some areas, the websites are really wonderful information that people can utilize to implement some of those meal plannings that they're thinking about. Of course, consulting with their physician and the healthcare team first.
So thank you all for those suggestions. How much is pork the same as red meat? I understand the composition is different and it's not fully white meat, but as I understand it, pork is kind of in the middle.
Yeah, that's a hard question to answer. I struggle with that myself. I consider pork red meat in my mind because it has the attributes of it, and it's closer to beef in that nature than chicken. So
I agree.
yeah,
Actually, pork it is red meat, and I know there's this misconception around white or it's not as red, and it's maybe in the middle, but it's actually in the category of red meat.
oh my God, I had one patient who told me that beef wasn't red meat because it turns brown when you cook it. So yeah, I agree with you. I categorize as it red meat. I don't have, thank you, Lena, because I don't have really a lot of knowledge nutritionally for why that is, but it seems to be that way.
Great. Thank you for clarifying. Next question. How can I determine the best or at least a good vegetable protein drink? So I think a plant-based protein drink. I often use one based on pea protein. I'm just unsure if it's the best option.
Well, there's a lot out there. So there's protein powders that you can get. There's a company that we use at Sutter, and I've tried it for the last 2 years. It's called Kate Farms, Kate Farms, and they make an excellent product. It's not specifically for chronic kidney disease, but it can be used for that because it's all plant-based nutrition, no GMO, and very healthy. I actually liked it. There are very few protein shakes that I can drink out of a box that taste good, and this is one of them. So that's one. Vega One is another option. Orgain is another option. So those are more powder based. But if you want something that's created together, almost like a Boost, right, or an Ensure, Kate Farms is the way to go. So the opposite to that is I would not recommend Ensure, and I would not recommend Boost or Premier because they're really not geared for somebody with chronic kidney disease. They're really trying to provide calories for people who are malnourished and vitamins. And that's really not what you're looking for in chronic kidney disease.
Yeah, and I agree, Kate Farms, it is a good, yeah, definitely a good product for a shake that's already created, if that's what you're looking for.
Great, thank you. And we just have one last question. There is a lab test that describes sodium levels, but it is not called sodium. Do you know what it is called?
Okay, you got me on that one. So there is a lab test called sodium. And I think the challenge there, and I'm a nephrologist, so I love this kind of stuff. I love electrolytes. So salt and water go hand in hand. So if you eat high salt foods, your sodium level may not go up because you're thirsty and you drink more water. What happens is you get swollen, you get edema, and your blood pressure goes up. So the real answer is there's no one great test for sodium level because sodium's balanced with water. The best test is actually the scale. If you're gaining a lot of weight and holding on to water, you can tell that. And we certainly know that from people on dialysis. But then also, you know that yourself, if you go to have a pizza, the next day your legs are swollen. It was the high salt from the cheese and the pizza. Or if you go out for Chinese food, that's my other favorite. The soy sauce has a lot of salt in it. So the next day between that and the broths, you're really edematous. So really you can tell by your blood pressure and by your body, not so much by the lab test.
Great, thank you, Dr. Mouratoff. That brings us to the end of our questions. Unless anybody has any other questions, either from the panel or if anyone would like to raise their hand and unmute and ask them verbally, we're happy to answer.
Yes, I think you answered my questions. There seem to be a lot of things that have been mentioned, but a lot of them came by so fast that I didn't have time to write them down.
Was something in particular that maybe you missed?
Well, if I knew what it was, I just remember there's been a lot of apps mentioned, and although he did say MedChefs in pcrm.org, there was one, what's it called? Thistle?
Thistle.
Thistle, that's a meal plan. Yeah,
Okay,
Thistle.
all right.
And also this education webinar, right? That's gonna be it was recorded and it's gonna be posted, right?
Yes,
Yes.
so it will be sent out in a post-event email. So you'll be able to access both Elena's slides and a recording of the webinar. So you should be able to go back and kind of find those recommendations as well.
Okay. All right, thank you.
Of course.
Um.
And we have a couple more hands raised.
Yes. I guess I was concerned about the pork because last weekend I ate pork.
Well, Maria, one meal is not enough to make a difference, but if you
Okay.
eat pork every day, that could be significant. So the same thing, that first gentleman that I mentioned, he did so well. He loved sausage, which is pork. And he would have
Yeah, that's
he would
right.
have his sausage every 2 weeks. So I think once you're in good health, you can start experimenting with adding back some of your favorite meals. And I
Right.
don't consider them cheats. I consider them treats. You earned it, right? So,
Right.
you have to
I'm
live your life.
I'm
Yeah.
stage 3A. So I'm really careful. So I'm doing plant-based, but sometimes I have, white meat, chicken, and fish. I love fish and shrimps. Shrimps is okay, right?
Well, that's the one I was joking about. So no, shrimp is really, one for purines, it's really high. So if you have gout, that could be not a good choice. But also it's
Oh,
really high in protein and cholesterol. So I tend to choose more fish, such as salmon, and
yeah.
other like trout rather than shrimp.
Okay. All right. Noted. Thank you.
You're welcome.
I think that finishes the meeting off. I'd like to again thank our partner, the National Kidney Foundation, and our sponsor, Horizon Therapeutics, as well as Dr. Mouratoff for joining us in today's session, and all of you for joining us at all 3 sessions.
Yeah. Thank you guys for inviting me.
Thank you, everybody.
Thank you
Thank
for
you.
coming.
Yeah, my pleasure.
Thank you all. Have a great evening.
All right. Bye-bye.
Bye.